Want to be involved in a healthcare clinic but don't know where to start? Today we'll be talking with the USF Health BRIDGE Clinic. All that and more coming up next. Hey Honors Bowls! Welcome to the Honor Roll Podcast, the flagship podcast of the Judy Genshaft Honors College podcast network. I'm your host, Riva Gandhi, a fourth year studying biomedical sciences and public health and a member of the Honors College. Today, my co-host is Fabiana Requena, a fourth year studying marketing and business analytics. Hey Fabi, so nice to have you here.
I'm so excited to be here with you, Riva.
We have such a fun time together.
I know, we do.
As always, we like to start off our podcast with one big question. So my question this week is, what is something you wished was more talked about in healthcare?
I love that question, Riva. I'm really passionate about nutrition, as you know.
Mm-hmm.
I know you are too. I think that what we put into our bodies and the way that we feel ourselves is so important, especially like our gut microbiome. I know that has a lot to do with our mental health. So I think that if people took more care and were more educated and had the resources to be able to feed themselves well and nourish themselves, we'd have a much healthier and longer living population.
I agree and resonate with that so much. And kind of piggybacking off of that answer, I think women's health needs to be discussed when we talk about nutrition because our hormones play such a big role in how we function day to day. And a lot of times they're influenced by what we eat or don't eat. And I think even people who have access to foods don't necessarily know what is best for them to consume and how what they eat is influencing their daily functions. And I think if we talked about it more, many health conditions could be minimized or prevented even.
That's so true.
Mm-hmm. And this week, we're excited to have USF Health Morsani medical students Mónika, Domenech, Acevedo, and Andrea, Medina, Garcia, and honor students Skylar, Robbins, and Shenica, Jerome, to share their experiences volunteering with the USF Health BRIDGE Clinic. Stay tuned.
Thinking about joining the USF Judy Genshaft Honors College? Sign up for a tour. They're led by honors ambassadors, real students who can give you the inside perspective you won't get from a website. You'll be learning about honors courses, student life and events, mentorship opportunities, scholarships, and professional development resources. All while exploring the honors building and hearing what the experience is really like. If you're ready to see what Honors at USF is all about, sign up for a tour today.
The USF Health BRIDGE Clinic is a free clinic located in the USF Tampa Bay community. They're a student-run free healthcare clinic that serves uninsured patients that are 300% below the poverty line. From medical care and public health to social work and physical therapy, the BRIDGE Clinic offers a variety of medical services and healthcare specialties to advocate for health equity in Hillsborough County. Today, we're joined by members of the USF Health BRIDGE Clinic. Thank you so much for joining us. Would you like to introduce yourselves and share a little bit about your role at Clinic?
Of course, I guess I can start. Hi guys, my name is Andrea. I'm one of the senior directors at Clinic, so happy to be here. I am a fourth year medical student at USF, and I'm going into neurology. That's exciting. Next.
I'm Mónika. I'm a third-year medical student, and at BRIDGE, I've had a couple of different positions. My current one is junior director, and I'm excited because I'll soon be transitioning to medical director next year.
Congratulations.
Thank you. And it's really been an honor being in BRIDGE and both being invited over here to talk about BRIDGE. I'm still figuring out what I want to do, but I'm leaning towards general surgery. We'll see where life takes me.
Hi, everyone. I'm Skylar. I am an undergraduate student here at USF, and I am the Quality Control Team BAT Clinic Director and an Operations Coordinator at BRIDGE Clinic. Long titles, but basically what I do is just make sure that all the paperwork is filled out correctly so the patients don't have any issues when they go to get their labs done or their prescriptions filled.
Hi, everyone. I'm so honored to be here with all of you. My name is Shenica. I am also an undergrad student here at USF. I am studying cell and molecular biology and psychology, and I'm on the pre-med track. Right now, I'm really interested in infectious disease, as well as gynecology. I'm still kind of like figuring that out, but those are like my top two at the moment. So as for Bridge, my role is co-clinical director and an HIV testing counselor for the public health team. Just to kind of explain our process a little bit, our team is full of certified HIV testing counselors, and part of our procedure is conducting a risk assessment interview as well as conducting a rapid HIV test. And so that's just a little bit about what we do.
That's amazing. Thank you all so much. That was perfect explanations as to what you do at Bridge for somebody who is unaware. For our listeners who may not be familiar, the Bridge Clinic offers a variety of health services for underserved communities in Tampa, while also creating a lot of meaningful learning experiences for students like you guys. Can you share the mission behind Bridge and maybe what a typical day at clinic may look like?
I can start with that one. You already hit a lot of the points in the introduction, like you said, where we serve an underserved population with patients that are below 300% of the poverty line. So as for a day in clinic, we approach the clinic day with a multidisciplinary approach. Public health is one of them. Physical therapy is one of them. We have our wonderful QCTs that help us out. Also, social work and pharmacy. So I think that's everybody. Let me know if I missed any of them. But the way that clinic works is we go ahead and have our front desk people check in our patients, and then our wonderful QCTs help us bring them back. And then we do this little thing called huddle, where we go and we talk to all of the medical volunteers saying, hey, here's the plan to see all of our patients and the different teams. And then they go ahead and start doing that. They review the charts and they go and see their patients. And then after that, the disciplines can see their patients. We all encourage them to see all of the patients because we want to make sure our patients are having a very well-rounded visit while they get there, while they are there at the clinic. And then once all the patients are done, we check them out and then we clean up, and that's the night.
One of my favorite things about clinic is the days are very hectic and they can be long. We start at around 5 and we're typically done between 9 and 10. And they're hectic, but they're so meaningful. And one of my favorite things is, watching the medical team, which consists of medical students. So correct me if I'm wrong, but third and fourth years.
So all of the medical students are free to volunteer at the clinic. We have a system where there's a junior and a senior on a team, except for our fast track team. That's just the senior team, so they don't have to be teaching. So there's one junior student and then one senior student. So the senior student is there making sure that we're asking all the questions, right? And the junior student, which would be the first or second year, right? They would be there to learn, maybe even do some of the history taking, which is really exciting for them. And if they're really gung-ho, then they can help with the note, which is a big thing in medicine, the documentation.
I think that's so incredible because you see the first years learning from their senior students, and then a resident or attending goes back in with them and they learn more on top of that. And it's always very interesting for me when they come out and they're doing the paperwork and they'll be telling the team about something that happened in the room. And I don't know anything about medicine yet. That'll change soon. But it's interesting to learn and understand the reasons why we're doing something, because we see the referrals when we go to the doctor's office ourselves, but we don't know why or the meaning behind it. But as you mentioned, Andrea, you are working with a very diverse team. And because, we're under a time crunch and we're trying to be efficient and effective, what is it like working with such a busy and big team?
I would feel like it's, about planning beforehand. We always there's a team member that's planning like the patient list and having the patient tracker. And we have like the Google Sheets or like Excel sheets where we keep track of the patient statuses. And that's a new thing that we implemented this year. And I think that's been really helpful in helping us know how much time we're spending in checking in patients, moving them back, how much time does it take to see a patient, when can public health, social work come in, or physical therapy and pharmacy. So it's always a work in progress. But I feel like we have made a lot of advances in that sense. So it's about preparation and always finding things and areas where we can improve.
You guys sound like such a beautiful ecosystem that really comes together and works together. You all help each other. And it almost sounds like when you're describing all the different like levels of students that volunteer, it sounds like a generational thing. Like you pass things down, like stories and wisdom. It sounds like a really unique experience. Something else that I noticed was that your teams are very interdisciplinary. You're made up of medical students, undergrad students, physicians, social workers. What's it like to work on such a diverse team with all these people?
So for the public health team, all of our students are brought together by a shared love and passion for the field of public health. So we have a very diverse group of students. We have master students a part of our group. We also have undergraduate students a part of our group, all studying various different majors. So we have some students studying anthropology, biomedical anthropology, biology, cell and molecular biology, public health, health sciences, a bunch. And it's just really insightful being on a team with people who have such diverse backgrounds, who also have diverse aspirations as well, because not everyone is pursuing like the same health track, which is really interesting, and kind of getting to learn a bit more about that is also very fascinating. And with those diverse backgrounds too, everyone brings a different skill set to the table, but we are all again connected just by our shared love and passion for public health and wanting to educate and focus on prevention and things like that. So yeah,
I agree with that. I would say there's definitely a shared love there, but then we also bring something different and we're able to add. I know at least for QCT, working with Skylar, we have different approaches on how we go about filling out the paperwork or talking to the med team, but we're able to, come back together and make sure things are accurate. As a leader for the QCT team, what is it kind of like to be able to balance all of those responsibilities of making sure the paperwork's filled out correctly, but also, making sure patients are at the forefront of everything we do?
I think like Andrea mentioned, preparation is key. We have a big quality control team, so we have people working in the front, we have people working in the back, and I think the key is definitely communication. So how the back of clinic works is we have a left side and a right side, so green and gold, go Bulls. And there's a quality control assistant on both sides, and then whenever the med teams will come out of the room, they'll fill out all the paperwork with the quality control assistant and then the operations coordinator. And then once it's all filled out, they'll bring it to me to check. And I think that just the communication of talking to the quality control assistant talking to the operations coordinator talking to the med team and the attending. And I think just keeping everyone in the loop is so important. And then also between the front and back of clinic, we have a runner who runs between the front and back. So definitely just communication and understanding where everyone fits in and the roles that everyone has and making sure that everyone's where they need to be, and doing what they can, because we also don't want to keep the patients there longer than they need to be.
A really great initiative that we started this year and that has really helped us with our efficiency is a clinic status board. So that has been super amazing. Everyone knows where everyone is because of our wonderful little computer system that one of my colleagues, one of the other fourth years that helped develop it, he's very good with computers. And he always helps us when we're troubleshooting and when we're having issues.
Great. Now that we have like a good understanding of what you guys do at Bridge and your individual experiences, Skylar and Shenica, I wanted to ask you, you're both part of a wide network of honors students and alumni that have volunteered with Bridge Clinic since it's opened in 2007. Why did you personally choose to join the Bridge Clinic?
I kind of want to share a little story about how I found out about the clinic. Fun fact, it was actually through an honors course where we were kind of focused on nonprofits and kind of understanding like the different parts of a nonprofit and how they work and things along those lines. And there was a student who was on the interpreting team who did his presentation on the Bridge Clinic, which is how I found out about it my very first year here at USF. So the moment he gave that presentation, I just knew this was a clinic I really wanted to be involved involved with. I felt like it resonated with a lot of the work that I see myself doing personally as an aspiring physician. So I asked him, and I was inquiring about just like how can I get involved, and he was kind of telling me about the interdisciplinary nature of this clinic and how there are a bunch of different teams involved. And I was drawn to the public health team because again, going back to just like the things I want to do as an aspiring physician, public health is at the core of that, I feel like. And somehow the stars aligned, and at the end of the semester, I saw a flyer posted by the public health team and their recruitment for HIV testing counselors. And infectious disease is an area that I'm really interested in. So I just thought like this was very perfect. And was something that just resonated with me, and I applied, and here we are. So that is why I joined the clinic. Yeah.
So I actually joined the clinic. I first found out because I was looking for volunteering positions and I couldn't drive. So I needed somewhere on campus, and I was actually at a Judy Genshaft Honors College student council event, and I met this amazing, wonderful person, and she told me that she was at Bridge and told me about the quality control team and was telling me that they were looking for volunteers. And at first I was really confused. I was like, what is quality control? And she was basically like, we just go over all the clinic documents, make sure they're filled out correctly. And I thought it would be really cool because a lot of clinical experience, is definitely more patient-centered. And while some roles at clinic definitely are, even for undergrads, like operations coordinator, I really liked because you're able to see clinic from, the back end and how things go. And I think it's just really cool because it's a different perspective that you're not able to see a lot of the time. So I was really drawn to that. And it was on campus. So I was happy. And yeah.
And we're very, very glad you ended up joining clinic. I love how that role of QCT has evolved so much over the years, because when I started 4 years ago, I started in the office, literally going through an entire filing cabinet worth of charts. That did take me a whole semester and a half because we hadn't been audited in almost 2 years, so we had to really up our game a little bit. But ever since then, it's changed so much. We're now using iPads to fill out paperwork, and I'm so excited to see how it's going to continue to grow, Mónika, as you take over next year.
I know you were really excited when they brought in the iPads because you came to tell us. You were like, the iPads are in.
Save so much paper with them. I mean, we've already noticed that.
Yeah, it's much better versus like an analog system, of course. Much faster.
100%. But Skylar and Shenica, as honors students, how has Bridge shaped your honors journey beyond the clinic itself?
So I think what's so cool about Bridge, like I mentioned, obviously you get that more management side of a clinic, but also how we have different specialties each week. So we have neurology, dermatology, orthopedics, pulmonology, just tons of specialties. But I think it's really cool because I'm also a pre-med student, and a lot of times it's hard to see kind of how the different specialties interplay and see them in their natural habitat. So I think it's really cool that we have different specialties that come into clinic, and I'm kind of able to talk to the different residents or the different med students who are interested and hear their stories and their path to that specialty. And I think it's really cool because I've been able to go to more honors events focused on different specialties. Like student council hosted a pre-MD event, and I thought that was really cool because it also had different specialties, and I was like, oh, I already knew that, like from Bridge. So I think it's just really cool to get a more personal experience with each specialty without going to shadow, and just being able to talk to the different, med teams that comprise that specialty.
Well said, Skylar. Kind of piggybacking off of what Skylar has mentioned, I feel like as honor students, we often hear the word interdisciplinary, and favorite word over here. And I honestly think Bridge is the epitome of that. And kind of going back to what Skylar was saying, and with all of us being here from all of our different disciplines, it's just a wonderful environment and space to be in, and to get that firsthand experience as to how healthcare, I feel like, should be, collaborative and with different disciplines. So as an honor student, I've been able to share my own experience with other honor students to kind of give my perspective, my insight as being a volunteer on the public health team, because I feel like in regards to Bridge Clinic, sometimes it's hard to know about what's going on like in the clinic if you like don't know anyone else who's already in the end. So being able to kind of share my experience with them and to whenever we have our applications open to share that with like the honor roll, for example, and to kind of have that word spread around through the Honors College and things along those lines. So yeah.
Mónika, your journey at the Bridge Clinic began while you were an undergrad here at USF. How did your various roles during your undergrad years help you prepare for medical school and your career in healthcare?
Yeah, I guess, I guess I'm so far going in the trend of you stay forever. We'll see where residency takes me. But yes, I went to undergrad at USF, and it was a hard time because, COVID hit, and then I was trying to find out like volunteer opportunities. And, eventually Bridge came back to from being virtual to going back in person. And it was like a strange time because unfortunately they weren't like many interpreters. So I was like maybe like one or two, maybe three interpreters. And they would like have us like float around in different teams. But it was definitely a little bit challenging at first because even though I'm a native Spanish speaker, like the medical terms, I'm not very used to using them like very like frequent. Like the terms that I use at home with my parents are different to the ones that I would use like medical lingo with like the medical teams. And not that we like use medical terms when speaking to patients, we try to break it down to layman terms. But still, like there's like, since I'm also like Puerto Rican, we use a lot of Spanglish. So like it was, navigating that transition. But like it was very exciting because I was still like confused about whether I wanted to medicine or not. So that really helped me like hone in and see what patient care is about, what medicine is, by being put like side to side with the medical students, and just like hearing their thought process of what they think they should do better for this patient, not just medically, but also like considering like their social determinants of health. Like, unfortunately, they do come from like more backgrounds where they don't have as much access to like like many resources. Like if we say like, eat healthy, it's not as easy for them to go ahead and just have access to those products. So just like taking those things into consideration, all of it while interpreting and observing the medical students do their job. And I feel like working side by side with the students, I also had the opportunity to get some mentorship for myself. And then when I got to medical school, I actually like felt pretty good when I had to do my first standardized patient encounter because I like knew more or less what's the flow, how to take a HPI, the pertinent questions for, let's say, knee pain, and thinking about the different things that could be playing, social factors as well. So I felt good that like Bridge, like obviously it's about like helping patients, but there's always something that we can definitely gain as a privilege.
I think that's so special, especially when you were talking about working around COVID. I think that really ties back to honors and the experiential learning that we really pride ourselves in. And you were able to see, not that like Bridge has a lot of like happy, cheery, we're seeing a lot of sick patients, but you also saw the tough times of medicine where things, might not be flowing as well as they should have. And being able to see that directly on the field before even entering the field as a professional is really different and really special because you saw what you're getting yourself into. And not a lot of us can say that we had that opportunity to do so.
Right. Because in the classroom, you are only really seeing how things are in a textbook or maybe from experiences from other people, but you're not actually seeing, all the dirty work that goes behind that.
And you don't see, how difficult it is for these providers. Like during COVID, you say eat healthy, but then there's no food to eat healthy. And when you're talking about social determinants, that only increases the risk when you're working with low-income patients. So I think that was a very unique experience that I'm sure not many people can relate to. So that's very cool. But Andrea, you actually serve as the senior director at Bridge, and you help kind of coordinate all of the teams. How do you see Bridge as kind of an incubator for developing leadership skills?
Yeah, I would say I didn't have the opportunity to be a junior director, so I feel like I was at a different place than the other senior directors who were. So I honestly I felt a little intimidated because I didn't know the skills that I was going to need. And over these past few months, we started in March or so of this past year. Since then, I've just seen myself grow as a leader, being more confident in my decisions, because as a senior director, you're the last person that people come up to you for questions. Like, hey, can we take this walk in? And we have to decide at 7:30 whether it's worth it or not. I take the time to talk to the patient and see if it can wait until next week or not. So yeah, being confident in making decisions, being able to delegate things that can be delegated to other people, knowing how to communicate well, even conflict resolution. I've become really good at that. There's lots of disciplines that we talk to, and sometimes we might not be on the same level. They're not looking eye to eye, and, really establishing how we are approaching different things has been really helpful.
I'm sure you've gained a lot of confidence from this experience, and when it's time for you to have a role as a physician, you're gonna be super prepared.
Yes, Bridge has definitely been something that I've brought up in a lot of my residency interviews. One time I had to apologize to the interviewer because I said, you know what, these are all the answers can be answered by things I have experienced in Bridge. I'm so sorry. And they said, you know what, it's okay. It's been a really good experience for you. I hope they weren't lying to me.
So, in addition to patient care at Bridge Clinic, you also have opportunities to be able to research, which is really fun. Can you tell us a little bit about the projects like the Society of Student-Run Free Clinic Conference? You actually, I heard you won 2 out of 8 awards. Tell me a little bit about that.
That's like a clinic, that's a conference that they put on for a lot of free clinics nationally. And Bridge actually won 2 out of the 8 patient awards. So do you guys want to talk a little bit about research? Because I know a few of you presented there.
So our research more so focused internally on our own volunteers and what they were getting out of this experience and kind of like their thoughts, their motivations, their aspirations, and why specifically they chose to be a part of our team. And so we just sent out a survey that we had, the directors had constructed, and our volunteers filled it out. We also got some information from some of our volunteers who had already graduated and were further along in their academic journeys, or like in medical school, for example. So it was just really insightful getting that feedback from them and kind of learning about how this experience had impacted them. So that's kind of what our research was more so about. I think Andrea can probably elaborate a bit more on the medical side of this.
Yes, you're really involved with the CGM project. You want to talk about that?
Yeah, well, the CGM project, I joined in a little bit later. So most of the data has already been collected. I was somewhat like behind the scenes observing on how it was like the data was collected. I know another Andrea from our class was very involved in like making sure patients were scheduled to get their regular CGMs and making sure educating patients on how to use it and doing the data analysis along with Gabby, our other senior director. And they did an amazing job in like compiling the data and finding out that, CGM use definitely helps patients more or less gauge like what types of foods they should be eating and get better control of their diabetes. So I think that was very remarkable. I'm still like working on the end of like making sure like patients are getting their CGMs and who qualifies, who doesn't, and making sure that pharmacy is also helping on board.
And that's such a good example of interdisciplinary research. What does CGM stand for?
Right. I'm so sorry. Continuous glucose monitoring. Yes. So pharmacy is definitely very involved because actually like going into medical school, like I didn't really know what pharmacy people did. So like I know they do more than just like prescribe medicines and count pills and like measure things and all that stuff. They help with diabetes counseling, like how to check their like glucose at home with a glucometer. They help with vaccines. And so they also help with the CGM. So Right now, I make sure that we keep track of the CGM inventory that we have, and we communicate to make sure that they are giving the CGMs to the right patients and going over how to use it and appropriately and how frequently to change it and scheduling appointments further out. Yeah. So
This was one of the projects that won a big award.
yeah.
Very exciting.
That's very cool. And I love how we have so much research involved at Bridge that goes not just serving our patients, but also other clinics around the country. Now, as we wrap up a little bit, we'd love to hear from all of you. What is one reason students should get involved with Clinic? Andrea?
So I think it's been a really through line of our conversation today, having this interdisciplinary experience, being able to interact with so many different kinds of people, of course our patients, but also different types of professionals. We have our volunteers who are usually undergrads or medical students, but we also have the faculty that we interact with. So just having that amazing opportunity to, even talk with everybody is awesome.
Yeah, I guess I can take a lot of things from Bridge. But if I have to say, I guess definitely working with patients, hearing their stories, really gain a lot of that from not just the medical aspect, but understanding where they're coming from and, developing that sense of compassion and empathy. And then more on the administrative side, there's a lot that goes behind the scenes that I didn't know about beyond just the medical knowledge. So it's been really rewarding to see all the things that are involved to make sure the clinics run smoothly, and it's all about a good team and team effort.
I feel like you guys hit so many great points. The project that I helped work on was the spreadsheet project. Like we talked about a little bit earlier, the status board, it helped track where patients were in clinic. We were previously using paper sheets on all the doors, and it just wasn't efficient. And we actually won the Patient Impact Award at the Student Run Free Clinic Conference. And we're writing a manuscript. So Jacob, who developed the status board, is hoping that other clinics will be able to adapt it. So it's just showing how the impact of Bridge goes far beyond just the patients we're helping each and every day, and hopefully into other clinics throughout the U.S.
So yeah, going back to that cultural competency component and meeting patients where they're at, I think that is a skill that you can only really develop when you put it to practice. And just navigating conversations surrounding HIV can be very difficult. And not everyone might know where to begin. And so I feel like when you when you challenge yourself and you put yourself in these situations and you gain these experiences, it kind of helps you to further develop skills along those lines. So yeah.
Can I just say that I'm so excited for all of you to be healthcare professionals. I'm really excited. I really love today's conversation, Riva.
Yeah, it was really special getting to know, obviously I'm a part of Bridge, but getting to talk about it in an official capacity, it makes you really think about how much we have to offer and how much we impact not just our patients, but also the trajectory of our futures and our careers. And if you're looking to get involved with the Bridge Clinic, you can email the Bridge Clinic at bridgeclinic@usf.edu or bridgepublichealth@gmail.com.
All right, we are back in the studio, Riva. That was an amazing podcast. I just wanted to keep talking to them.
I know, and this topic is something that's so near and dear to my heart. I mean, you're talking about people who don't have access to care, who lack health education. And I think, hearing from undergraduates and medical students and seeing that passion going into, there are future healthcare professionals, and seeing them have that passion in them really excites me for what the future of healthcare looks like, and maybe one that could have a little bit more health equity in it.
Absolutely. And the fact that you're getting so many opportunities to have these hands-on experiences, you're really dealing with what it really is like in a day-to-day practice. I'm really happy that there's opportunities like this and that even undergrad students can be a part of this as well, not just physicians or people in their residency and such.
Yeah, and when I started 4 years ago, I never thought it would flourish to what it has
Yeah.
become, and I think it's played such a pivotal role, not just in my honors experience, but my experience as a future physician, and I think anybody who has the availability and wants to join should definitely do so. And with that said, if you're interested in learning more about the USF Health BRIDGE Clinic or other health opportunities, don't forget to check out the Honor Roll newsletter and our website at usf.edu/honors for upcoming events, updates, and news.
Production assistance is provided by USF students Valma Shah and Nicholas Henry. Please do not forget to rate and review our podcast, as we really appreciate your feedback. Please join us next week to hear more honor stories and talk to more members of the Judy Genshaft Honors College.
Until next time, go Bulls!